In this morning's Health Watch, preventing medical mistakes. An estimated 99,000 deaths each year are caused by preventable medical errors. And in perhaps the most high-profile case of its kind of late, actor Dennis Quaid and his wife nearly lost their newborn twins after a horrible mistake back in 2007. When Thomas and Zoe Quaid were born, parents Dennis and Kimberly were elated. But that joy turned to outrage when a drug mix-up at Cedars-Sinai Medical Center in L.A. caused the twins to be given a massive overdose of the blood thinner heparin.
It was the scariest, most frightening day that I think either of us have ever been through.
The newborns were supposed to get a pediatric blood thinner named Hep-Lock, but instead they were given 2 doses of heparin, the adult version, 1,000 times stronger.
The nurse didn't bother to look at the dosage on the bottle. It was 10 units that our kids were supposed to get. They got 10,000, and what it did is it basically turned their blood to the consistency of water.
After undergoing extensive medical tests, today, both children show no signs of permanent damage. The Quaids have created a foundation to raise awareness and address the problem of preventable human medical errors. And joining us now from Washington, our actor and patient safety advocate, Dennis Quaid, and Dr. Charles Denham, chairman of the Texas Medical Institute of Technology. Good morning, gentlemen.
Good morning, Harry.
So glad to see you. Dennis, first things first, how are the babies doing? How old are they now?
Well, the babies will be 2.5 in about a month, and they're doing great. I can hardly keep up with them.
I'll bet. This is when they really start to take off.
Yeah, it's
we just played this tape back and used your conversation with Steve Croft from the 60 Minutes piece. Those days when those children were really in a life and death situation, there were many hours when they were literally at death's door from a very simple and, as it turns out, quite common mistake.
Well, it happens too often in hospitals all over this country, Harry. Healthcare harm, when you take in infections that are acquired in hospitals, are the 3rd leading cause of death in this country, and the amazing part about it is that it's preventable.
Yeah, it is so interesting because as your story spread around, you start to talk to other people, you start to become part of a conversation, you realize it is so phenomenally common. As you've started to do more and more research into this, and I know you're working on a documentary, what have you found?
Well, after the incident that happened to our twins, my wife Kimberly and I, we started our education about healthcare harm in this country, and something I never expected to get into, and I always felt very safe in a hospital. And that led me to meeting some leading experts, and I happened to meet Dr. Charles Denham, who's here with me today, who's one of the leading experts in the nation on healthcare harm, and he's given me quite an education.
Dr. Denham, why is it, give me the simplest answer possible, why a simple, seemingly simple mistake is the one that happened in the Quaid's case, why do these things happen?
Well, we don't have bad people, we have bad systems, and we just haven't caught up with our support systems to the complexity of care that we deliver. So human error happens all the time, but they're spread over thousands of hospitals, and without these support systems, human error, honest errors can happen.
Yeah, help give us some advice, the viewers at home. What do we need to do as patients to make sure that something like this doesn't happen to us or one of our loved ones?
Well, the first thing to do is to just make sure that you have someone with a loved one at a hospital, so that 2 heads are better than 1, and the caregivers, really good caregivers, love to have patients and families involved. Second thing is that to always ask everyone to wash their hands, and do it in a gracious way, but say, have you washed your hands? Because that's a major issue, and infections, as Dennis alluded to, are a major issue. The third is that when you leave the hospital, make sure to get your medical records. You might be the most vital link to your next caregiver. The fourth thing to do would be to have a list of your medications and reconcile that like you would your checkbook at home, so that you make sure you have that. And
Yeah.
the fifth thing would be, when you see your doctor, ask what you're there for and what you do next.
All very, very, very good advice. Dr. Charles Denham, thank you so much. Dennis, we will look forward to seeing your documentary on the Discovery Channel in the
It's
not-too-distant
called
future.
Chasing Zero, Winning the War on Healthcare Harm.
All right, great to see you. So glad those kids are in good shape. Take care, folks.
A lot happens early on The Early Show, weekday mornings on CBS.